So a tuberous breast is a congenital abnormality of breast development, and it can actually affect women and men, and it can affect one or both breasts. And basically during puberty, breast development is affected or blocked such that the normal breast doesn't develop fully and maturely. And we don't know really why it happens, but it's probably been around, been classified since the mid-1970s. And basically the physical characteristics are that the patients often present with sort of big puffy nipples or areolas. They have usually very widely spaced breasts, and they have very short distance from the nipple down to the breast fold, and the breast fold is often very high. And it's not really just a simple thing that the breast hasn't developed fully and normally. It's actually, as I said, an abnormality with the mature breast shape. Look, because often there's a problem with the nipple or the areola, which is, as I said, often puffy. It's often displaced or moves sort of towards the outer part of the breast. And so we often have to move the nipple centrally and also reduce the size of the breast. There's also these bands, fibrous bands that are going through the breast where you have to release. So it's not just a standard simple breast augmentation. As I said, it's not really known, but basically they've found a problem with collagen deposition in both women and men who suffer from this condition, and so it's something related to that in the womb when the breast is developing, and it's actually the breast doesn't develop completely, but it's actually really unknown why it happens. Yeah, so it's a combination of usually incision around the nipple to access some of the glandular elements of the breast, so releasing the fibrous bands or ring, if you like, and then using very shaped implants, which I use to really shape the rest of the breast, because you can actually change the shape of the breast by using these high cohesive gel implants that really change the shape of the breast, and that combination of usually a lift or like a mastopexy with an incision at the bottom, doing a standard breast augmentation can really give you the results that most women are after. But we really tend to use anatomical shaped implants because they're bigger at the bottom than the top, and they can really shape the bottom of the breast, because that's where a lot of the problem is. You know, they've got this high fold, and we often have to drop the inframammary fold and then use these really high projecting implants to get that great breast shape, especially from the cleavage through the inframammary fold up to the lateral cleavage line. So yeah, that's really been at the forefront of treating tuberous breast, is these anatomical shaped implants.